All right, this is chapter 1 for psychology. Section 2, what psychologists do. Students will be able to understand some of the major fields in psychology. Students will be able to understand how specialists in some applied fields of psychology serve people's needs. And the main idea is psychologists worked in many different fields, but they all focus on studying and explaining behavior and mental processes. All right, so what to think about? What are some of the major fields in psychology? How do psychologists in some applied fields of psychology serve people's needs? So some vocabulary terms that we're going to go over: psychiatrist and basic research. A psychiatrist is a medical doctor who specializes in the treatment of psychology problems and who can prescribe medications for clients. The difference between a psychologist and a psychiatrist is that psychologists cannot prescribe medications, but psychiatrists can. Basic research. Research that is conducted for its own sake. That is, that no immediate application, that has no immediate application. So research that is conducted for its own sake and has no immediate application. They're just doing research for the sake of it. All right, major fields in psychology. Many psychologists share a keen interest in behavior and all believe in the value of scientific research. They also share in the belief that theories about behavior and mental processes should be supported by scientific evidence. They accept something is true only if the evidence says so. Some psychologists are interested mainly in research. They've investigated the factors that give rise to behaviors and that can explain certain mental processes. They form theories about why people and animals do the things they do, and then they test their theories by predicting when the specific behaviors will occur. Other psychologists consult. That means that they apply psychological knowledge in the form of therapy to help people change their behavior so they can better meet their own goals. Still, other psychologists teach, share their own knowledge of psychology in classrooms and workshops. All right, clinical psychology. Clinical psychologists make up the largest group of psychologists. Clinical psychologists are the people most of us think of when we hear the word psychologist. All right, so the psychologists in this field help people with psychological problems such as anxiety or depression or severe psychological disorders such as schizophrenia. Clinical psychologists help their clients to overcome problems and to adjust to the demands of their lives. Clinical psychologists are trained to evaluate psychological problems through the use of interviews and psychological tests. And then these psychologists try to help the clients understand and resolve their problems by changing ineffective or harmful behavior. The work environment of clinical psychologists can include hospitals, prisons, university clinics, and private practices. Some clinical psychologists divide their time between clinical practices, teaching, and research. But these psychologists should not be confused with psychiatrists. And a psychiatrist is a medical doctor who specializes in the treatment of psychological problems and who can prescribe medication to clients. So if you are seeing somebody that is prescribing you medications, this is going to be a psychiatrist. Don't confuse the two. Now, they specialize in the treatment of psychological problems as well, but because they are not medical doctors, they may not prescribe medication for their clients. Psychologists, that is. Psychologists can specialize in the treatment of psychological problems, but a psychiatrist can prescribe you the medication. Psychologists can't. However, clinical psychologists often work together with psychiatrists to consult and determine the best course of treatment for a complex patient problem. Okay, counseling psychology. Like clinical psychologists, counseling psychologists use interviews and tests to identify their clients' problems. Counseling psychologists typically treat people who have adjustment problems rather than serious psychological disorders. For example, their clients may have a difficult time making decisions about their careers, and they might find it hard to make friends. School psychology. Your school district may employ one or more school psychologists. I can think of a few. School psychologists identify and help students who have problems that interfere with learning. Typical problems that school psychologists deal with are to include peer group and family problems, learning disorders, and problems in learning to read, write, and do math. School psychologists identify students with problems by talking with the teacher, parents, and the students themselves. School psychologists may also administer tests such as intelligence tests and achievement tests. These tests, which are usually given to large groups of students, help identify students with special abilities as well as students who need assistance. Educational psychology. What do they focus on? They focus on psychological factors such as motivation, emotions, creativity, intelligence, cultural factors such as religion, beliefs, and languages, economic factors such as the level of income earned by the person's family, and instructional methods used in the classroom. Developmental psychology. What do they focus on? They focus on physical, emotional, cognitive, and social aspects of life. Physical, including changes in height and weight. Emotional, for example, developmental of self-concept or self-esteem. How do you feel about yourself? Cognitive, such as childhood to adulthood and mental images of the world outside, or how children learn right from wrong. And social, such as formation of bonds between parents and children, relationships with peers, and relationships between adults and children. Developmental psychologists also attempt to sort out relative influences of hereditary and the environment on development. Some developmental psychologists are especially interested in the changes of adolescence. All right, so here you see a little baby, and then she's a toddler, kid, teenager, I guess a working woman at that point. She's getting older, now she's retired. The stages of life. That's what developmental psychologists focus their attention on. Okay, personality psychology. Personality psychologists identify human characteristics or traits. Shyness and friendliness are examples of traits. They look for many different traits people have and study the traits' development. Social psychology. Social psychologists are concerned with people's behavior in social situations. So they might study the following issues, the ways in which women and men typically behave in a given setting, the physical and psychological factors that attract people to one another, the reasons people tend to conform to group standards and expectations, how people's behavior changes when they are members of groups, the reasons and the effects of prejudice and discrimination in the situations in which people are hostile and those in which they help other people. Experimental psychology. Psychologists in all specialties may conduct experimental research. However, this type of psychologist may conduct research into basic processes such as functionings of the nervous system. So that's how our brain connects to the rest of our body. We will get into that later on. Experimental psychologists explore the biological and psychological reasons for cognitive behavior. Now, what the heck is cognitive behavior? Cognitive behavior is the understanding that thoughts and feelings influence behaviors. So we got thoughts that create feelings, feelings create behavior, and behavior reinforces the thoughts. Man, they're all connected. Interesting. Basic research is research that has no immediate application and is done for its own sake. Now, experimental psychologists are more likely than other psychologists to engage in basic research. And this is one term that we mentioned at the beginning of the section. All right, so here's some review. Clinical psychologist is the largest group of psychologists. Their special areas within the field include child mental health, adult mental health, learning disabilities, and general health. They can help people with anxiety, depression, and specific disorders such as schizophrenia. Counseling psychologists. They typically treat people who have adjustment problems, such as difficulty making decisions about careers and friends, conflicts with the families, teachers, employees, and colleagues. School psychologists, they identify and help students who have problems that interfere with learning. Peer group and family problems and learning disorders. Developmental psychologists, they study the physical and emotional and cognitive and social behaviors within people. Personality psychologists, they're concerned with issues like anxiety, aggression, and gender roles. Social psychologists, they are concerned with people's behavior in social situations. They also focus on external influences such as the physical and psychological factors that attract people to one another, and the reasons why people tend to conform in groups. Experimental psychologists, they explore the biological and psychological reasons for cognitive behavior. And more likely than other types of psychologists, they engage in basic research. All right, applied fields in psychology. Industrial psychologists focused on people and work. Organizational psychologists study the behavior of people in organizations such as business firms. Industrial psychology and organizational psychology are closely related, and psychologists in these fields are often trained in both areas. Human factor psychology. Man, this is a lot of different jobs and careers you can pursue. These people focus on how people will use a particular product, how the product will affect people in their daily lives, the shape, the look, and the feel of the product, and how to engineer the product so that it's safe, comfortable to use. You might need one of these guys when you are running a huge business and you're selling products to people. Community psychology. These guys help create social systems and promote and foster individual well-being. Believe it or not, the building you're looking at, I used to work there. I used to work in this section, actually. I used to work at Devereux Advanced Behavioral Health. It's very weird looking at that building. I knew immediately that it looked very familiar. All right, community psychologists focus on the following: promoting change in the social environment rather than individual, helping relate powerless social groups such as children and the elderly develop coping strategies, and preventing threats to mental health in the social environment. Forensic psychology. When an attorney wants an expert witness to testify whether then the person accused of the crime had not been competent to stand trial, the attorney might call on a forensic psychologist. Now, you guys might have seen this type of person portrayed in movies. These psychologists work within the criminal justice system, in addition to testifying about the psychological competence of defendants. They may explain how certain kinds of psychological problems give rise to criminal behavior. Police departments also employ psychologists to do some of the following jobs: assist in selection of police officers, help police officers cope with job stress, and train police officers in handling of dangerous situations they may encounter, such as suicide threats, hostage crisis, and family violence. Health psychology. Health psychologists examine the ways in which behaviors and mental processes are related to physical health. They often work with many different healthcare professionals, including physicians, nurses, dentists, and dietitians. Rehabilitation psychology. Psychologists in this field work with patients who are struggling with the effects of a disability. Cross-cultural psychology. Traditionally, psychology studies have focused on people in industrialized nations. Cross-cultural psychologists, on the other hand, study behavior and mental processes under different cultural conditions. For instance, they examine such issues as depression and anxiety to gauge whether these concepts are perceived differently in different cultures. That's interesting. And they have been able to bring new insights on standard psychological theories. For example, they have discovered that visual perception develops differently in cultures as a result of the shapes and angles people are exposed to every day. So, depending on where you grow up, you might think differently. All right, psychology in today's world. Inside the criminal mind. So, when a horrific crime is committed, police detectives and forensic experts study the crime scene in fine detail. But in addition to the officers, a psychological profile examines the evidence. Now, these guys are popularized in television shows and movies. The profiler is a celebrated figure in forensic psychology. All right, let's talk about the polygraph machine. A polygraph machine measures the physical changes that occur in reaction to questions. This is very unreliable, and thousands of polygraph tests are conducted every single year. This is actually known as a false science when it comes to convicting a person when they go to jail, if they go to jail. Many who support the use of polygraphs claim that they are accurate 90% of the time. However, polygraph fails 1 out of 10 times. Unacceptable odds for an innocent person. Like I said, this is not a very accurate way to see if somebody is lying. They might be nervous, and that's why the heart rate might go up. I don't even think they can use this in a court case. But it says here, not surprisingly, the results of a polygraph test are not admissible in court. So you can't use this in court. You shouldn't be able to. It's not reliable evidence. If you're asking someone questions, oh, he failed the polygraph test. Well, you know what? He might have been nervous. All right, so one of the latest developments in criminal mind reading lies in brain imaging. Scientists have used MRI scans for years to identify neurological disorders. Now, some researchers believe that the scans can be used to detect lies. MRI scans show changes in blood flow when the brain performs a mental process. Interesting. I still don't think that you can see if somebody's lying doing that, but I guess you can see some type of change in the brain when someone is lying when you're hooked up to an MRI scan. All right, so a little bit of a review of everything we talked about. Major fields of psychology include clinical, developmental, and experimental psychology. Psychologists also work in applied, specialized fields such as community forensic and health psychology. That's your lesson for today. I'm sure you didn't enjoy it. It was quite boring. I understand. But peace out.